Thank you for listening to today's episode of Medical Device Global Market Access by Pure Global. Today, we're diving into a critical regulatory evolution in the United Arab Emirates that significantly impacts market access strategy for medical device manufacturers. The topic is the strategic shift from using a distributor as your local authorized representative, or LAR, to appointing an independent LAR. For years, the common practice for foreign manufacturers entering the UAE market was to appoint their local distributor to also serve as their local authorized representative. This was a mandatory requirement for registration with the regulatory body, the Ministry of Health and Prevention, often referred to as MOHAP. While this approach seemed straightforward, it created a significant business risk. The device registration was held by the distributor, effectively tying the legal market access to the commercial sales agreement. This meant that if a manufacturer wanted to change distributors due to performance issues or a shift in strategy, they faced a monumental task. Terminating the commercial relationship could jeopardize the product registration itself, potentially forcing a complete re-registration process with a new distributor, LAR, leading to costly delays and a temporary loss of market access. The old distributor could effectively hold the registration hostage, creating unfavorable negotiation dynamics. Recognizing this challenge, the regulatory landscape has matured. The UAE now clearly allows and encourages the appointment of an independent local authorized representative. An independent LAR is a third-party entity based in the UAE that is licensed to hold medical device registrations on behalf of foreign manufacturers but has no commercial interest in the sale or distribution of the products. This separation of regulatory representation from commercial distribution is a game-changer. By appointing an independent LAR, the manufacturer retains full control over their product registration. The registration is held in the manufacturer's name, and the LAR simply acts as the official liaison with the MOHAP. This model provides immense flexibility. A manufacturer can now establish, modify, or expand their network of distributors without ever impacting the status of their device registration. You can add a new distributor or replace an underperforming one with a simple commercial agreement, while the core regulatory approval remains secure and untouched with your independent LAR. This ensures business continuity and empowers manufacturers to build the most effective sales channels for their products. The independent LAR is responsible for the initial device registration submission, managing communications with MOHAP, and handling critical post-market obligations, including vigilance and incident reporting. This regulatory change in the UAE offers a more secure and strategically sound approach for MedTech companies. It minimizes risk, enhances commercial flexibility, and puts control back where it belongs, with the manufacturer. If you need help navigating the complexities of global market access, including the new LAR requirements in the UAE, please check out Pure Global. Thanks for listening, and we'll see you next time.